Greetings to all doctors who are watching us. I want to welcome you to this talk on demand of the International Forum on Women's Health, MUSA 2021. I'm Dr. Michael Hollick, and I speak to you from the United States. For me, it's an honor to participate in this important event and present this talk on demand to colleagues from Latin America and around the world. I would like to thank Technopharma for the invitation. It will be a pleasure for me to share with you results of my academic and scientific research. Now, I will quickly tell you a little bit about my experience. I'm an expert in the field of vitamin D. I am a professor of medicine, physiology, and biophysics at Boston University Medical Center. I chaired the committee for the Endocrine Society Practice Guidelines on vitamin D. I'm a fellow for the American Society of Clinical Nutrition, and I'm also in the Hall of Fame for orthomolecular medicine. I have published over 600 publications in well-respected peer-reviewed journals, 200 books, reviews, and chapters. I have great interest in women's health as it relates to vitamin D, and I'll be sharing with you my research and research from other investigators in the field of vitamin D. And I want to thank you very much for your attention. I'm grateful to have this opportunity to share with you the role of vitamin D for health. So it's titled The Delightfully Controversial Vitamin D. Is it really a vitamin? And it's important from health benefits from birth until death. People worry about conflict of interest, so I'm a consultant and speaker for Quest Diagnostics, Vital Choice, Ontometrics, Garbage and Amicus, Abbott, and Biogena over the past 3 years. I also get support from the Sun, and you could go to this website, drhollick.com, for more information about vitamin D. Now, I knew I had this varied audience with varied experience, so I went to a physician that I think you all know and recognize for his expertise and asked him for his advice, and he gave me just one simple comment.
You're an idiot.
Right, because what am I going to tell you about vitamin D that you don't already know about from the Institute of Medicine's report? They came out in 2010 with recommendations. And what was remarkable was that before 2010, it was recommended that all children and adults needed only 200 units of vitamin D a day. They reviewed the literature and realized that actually you need at least 3 times more. They also appreciated that vitamin D is not as toxic as we once thought, and they now recommended that adults could easily take 4,000 units a day. I'm constantly interviewed by the press asking me, what do I think about this? I have only one word for it: wow. Because there's never been a nutrient that's been tripled overnight. But the real question is, did they get it right? And the Endocrine Society in 2011 came out with its recommendations. And I chaired that committee, and all the members of this committee are experts in the field of vitamin D. And our objective was clear, which is to treat and prevent vitamin D deficiency, which is unlike the Institute of Medicine, which was population-based. So it's not a surprise that there are differences in recommendations. We recommend for infants 400 to 1,000 units a day, children 600 to 1,000 units a day, adults 1,500 to 2,000 units a day, and if you're obese, you need 2 to 3 times more. It's remarkable but true that who is at risk for vitamin D deficiency, and we now recognize, even in Ecuador and throughout Latin America and throughout the world, vitamin D deficiency is extremely common. And so vitamin D is essential for bone health, as you're well aware. So I thought I'd bring you a case that you may not typically see in your own practice. Here's a 7-month-old female, muscle weakness, tetanic seizure with a calcium half normal. And got a lot of publicity because it's the first lowland gorilla born in captivity at our zoo in Boston. And was seen by a pediatrician, given some vitamin D, 400 units. It didn't do any good. Concluded that this infant had some rare genetic disorder, nothing that could be done. Well, it turns out that the baby's complaining to mom, And Dad's upset because he knows his daughter's in deep trouble. Have you ever wondered what he was trying to say? That's what he was trying to say. In fact, even Mom suggested they call me. I got to see this infant. Infant has classic widened epiphyseal plates, classic for vitamin D deficiency rickets. So how do you treat? Aggressively. I gave the infant 5,000 units a day, and I was the guest of honor for her first birthday. What's the message? Mommy, will my growth be stunted because of her in utero and first few weeks of vitamin D deficiency? Most definitely, her growth was stunted. We estimate still today more than 50% of infants born throughout the world are born in a vitamin D deficient or insufficient state. 1889 in Boston, 80% of infants had rickets, right? But rickets, is it a problem today with all of modern medicine? You wouldn't think so, but we see certainly several cases a year at our hospital. It's a typical example, especially infants of color. Why? Because it's recommended that all the infant needs is human breast milk for its sole source of nutrition. Problem is, there is essentially no vitamin D in human breast milk. So if you give your infant human breast milk as a sole source of nutrition, that infant will be vitamin D deficient for that period of time. Now, I'm not sure what Brittany's thinking about, but we did a study and asked the question, in our pregnant women at our hospital, are they at risk if they're taking a prenatal vitamin? Because you would think that you're getting now all the vitamin D that you need. And we looked at 40 mothers as they gave birth and obtained their blood at the time. And we showed that even though 70% were taking their multivitamin and drinking 2 glasses of milk a day, getting 600 units of vitamin D a day, the amount recommended by the Institute of Medicine, 76% of moms, 81% of newborns were vitamin D deficient. Why should you care? Because preeclampsia, one of the most serious complications of pregnancy, we showed with Lisa Bodner, the higher the blood level, lower was their risk. This was followed up by another study showing preeclampsia, lowest risk, 40 to 50 nanograms per ml. That's 100 to 125 nanomoles per liter. Right? Vitamin D supplementation is important throughout pregnancy, because if you just give it in the early part of pregnancy, it may not have any effect. And this study showed that if you maintain a blood level of 25-hydroxy-D in pregnant women above 30 nanograms per ml, you reduce that risk substantially. Cesarean sectioning is becoming popular, right, for a variety of reasons. But you need good muscle strength for birthing. And it's well known that if you're vitamin D deficient, you have significant muscle weakness. And so we did a study at our hospital and looked at the association of vitamin D deficiency and cesarean sectioning. And we showed in 253 women giving birth, the higher their blood level of 25-hydroxyvitamin D, lower was their risk of requiring a C-section. Also, prematurity is a major issue these days. And there's a very nice study to show that if the blood levels are greater than 40 nanograms per ml at birth, less likely to have premature births. Indeed, there are the data. Gestational age at 25-hydroxyvitamin D, 60% reduction in premature births if your blood level is greater than 40 nanograms per ml. So, Mom, thanks for taking vitamin D. Right? I'm not sure what Christina's thinking about, but we recommend all pregnant women should be on 2,000 units of vitamin D a day, along with their prenatal vitamin. How much vitamin D does a lactating woman need to satisfy the body's requirement to put enough vitamin D in her milk to satisfy her infant's requirement? 6,000 units a day, based on the work of Dr. Hollis and Wagner. But pediatricians have been taught, be very careful, because pediatric patients are very sensitive to vitamin D. So how much do they need? They need it at birth onward. And even the American Academy of Pediatrics recommends that all infants receive 400 units of vitamin D a day, especially breastfed infants. So here is your problem, because you think if you have a healthy diet that you're getting all the vitamin D and other nutrients that you need. Turns out not to be true. Even in the United States, where milk and other food sources are fortified with vitamin D, we showed many years ago no one can get enough vitamin D from dietary sources. So dairy in the United States contains 100 units a day. So if you were to get the 600 units recommended by the Institute of Medicine, you'd have to drink 6 glasses of milk a day. And why is he carrying this mushroom? Turns out that mushrooms exposed to sunlight have the ability to make vitamin D. So it's actually a good source of vitamin D. But back in the 1940s and 50s, right, kids used to line up for cod liver oil because it tasted so good, right? It comes in an oil and tablet and an emulsion. But they suggest that you should eat fish. And there's no question that fish is good and healthy, but the dermatologists say you only have to eat fish in order to satisfy your vitamin D requirement. No need to be exposed to the sun. Problem is, this is not a pretty sight, because we showed many years ago, here's my son in Guatemala, sail fishing, catch-release program. They have no vitamin D, essentially. These rooster fish, they have no vitamin D. It's only oily fish, mackerel, salmon, herring, and it needs to be wild caught, and there's only about 500 to 1,000 units in a serving. And so you'd have to eat it every day. So this is where our sun is providing us with vitamin D. It's the major source of vitamin D for all of us. You're feeling great, making lots of vitamin D. Now you're taught, of course, to go out in the early morning, late afternoon, go jogging, make your vitamin D. It's great for romance, but you essentially make no vitamin D. You only begin making it at around 9 o'clock, and it's only from about 11 until 2 maximum time, and you stop making vitamin D after about 3 p.m., even living at the equator. Now, Star Wars, I always liked all of their various individuals the characters that they have, and Jabba the Hutt is my favorite, but I can never figure out what he was trying to say. And so I finally got it translated. No question, we now recognize that vitamin D deficiency is mainly associated with people with obesity. And the reason is that the body fat starts to acquire the vitamin D, and it's not bioavailable. So higher your BMI, lower is your 25-hydroxy vitamin D. Is it really there? We did the study and showed there's plenty of vitamin D in the body fat. And so obese people, as recommended by the Endocrine Society, recommends that they need 2 to 3 times more vitamin D to satisfy that requirement. What about gastric bypass surgery, right, is now becoming more common, right? The area that you're bypassing absorbs vitamin D. And so we showed, and others many years ago, you could lose 50 kilograms of body fat. Your blood level of 25-hydroxy vitamin D will not change. In fact, they often have a difficult time absorbing vitamin D and need much more vitamin D to satisfy that requirement. So what about people of color? So Pele here would have to be outside 10 times longer probably than his girlfriend to make the same amount of vitamin D. So now you may argue, okay, so people of color are at higher risk of vitamin D deficiency, lower blood levels, do they need more vitamin D? And turns out the answer is no, that it doesn't matter what your ethnicity, you can treat vitamin D the same way, because you have 4 different 25-hydroxylases in the liver, and they're very efficient initially in converting vitamin D to 25-hydroxy vitamin D. So how do you determine vitamin D status? I think you know this, right? That you want to measure 25-hydroxy vitamin D, right? And so, of course, doctors, we don't have time to think about what the blood levels are. Is it H, is it N, or is it L? High, normal, or low? And so typically at the end of the summer, patients will come back to the primary care doctors with an H, right? Are they vitamin D toxic? Well, I see lifeguards in my clinic, not so much the Baywatch babes. They could be over 110 nanograms per ml. Are they toxic? I don't think so. Indeed, you don't have to worry about intoxication. based on the Endocrine Society practice guidelines until you're over 150 nanograms per ml. What about the lower limit? How do you know if you need a blood level of at least 30 for maximum bone health? So we did a study in postmenopausal women throughout the entire United States with Ann DePape and showed that the higher the blood level, lower is the PTH level. In fact, the blood levels below 20 nanograms per ml compared to 30 nanograms per ml and above, you had a 3 times lower risk of having secondary hyperparathyroidism if you're above 30 nanograms per ml. So is vitamin D deficiency a health issue? Like I said in the very beginning, it's estimated worldwide 40% deficient, 60% insufficient. And this is occurring throughout Latin America, South America, and even in the most sunniest areas of the world, including Saudi Arabia and the UAE. The Endocrine Society recommends to guarantee vitamin D sufficiency, you want your blood level to be in the range of at least 30, and 40 to 60 nanograms per ml is ideal, which is 100 to 150 nanomoles per liter. Vitamin D deficiency, we know it causes secondary hyperparathyroidism, increases bone loss, right? It precipitates and exacerbates osteoporosis, right? What's happening is that PTH is increasing osteoclast number, chewing up matrix and mineral, leading to low bone mass and ultimately osteoporosis. Bone loss, holes in your bones, does not cause bone pain. So osteoporosis per se does not cause bone pain. But there is a bone disease associated with vitamin D deficiency known as osteomalacia. It is not a silent disease. And so typically, here the husband's talking to his wife, say, curiously, your aches and pains in your bones and muscles always occur in the winter. I wonder why. Symptoms: generalized bone pain, isolated bone pain, muscle aches and pains. Nouveau diagnosis: fibromyalgia, chronic fatigue syndrome, or simply often just written off as being depressed. No, most of these patients are vitamin D deficient, and in my clinic, they have dramatic improvement by correcting their vitamin D deficiency. Here, the Mayo Clinic proceedings showed 150 children and adults presenting with aches and pains in their bones and muscles. 93% were vitamin D deficient. Constantly complained to his dog, my bones and muscles ache. The dog said, stupid, you're vitamin D deficient. The Endocrine Society recommends should be at least 30 nanograms per ml, good for bone mineral density maintenance, also muscle strength, less likely to fall, and therefore less likely to fracture. How do you treat it? Right? Well, when you go to your gas station, do you get a gallon or liter of gas? No, you want to fill it up. So we started this back in 1998 and showed if you get 50,000 units of vitamin D once a week for 8 weeks. Why 50,000? It's the pharmaceutical form of vitamin D available in the United States. It's equivalent about 6,500 units of vitamin D a day. And so sure enough, you can fill up the tank. But now physicians aren't sure exactly what to do. What do you do when the tank is full? Well, you want to keep it full. And what we do is I give them 50,000 units of vitamin D once every 2 weeks forever. It's about 3,300 units of vitamin D a day. Now you may argue that vitamin D is fat soluble. And yeah, maybe for a couple of months it's okay. But what about year after year? So we did a study and we showed that over a 6-year period of time on 50,000 units of vitamin D every 2 weeks, about 3,300 units a day, right? Their blood levels were perfect at 40 to 60 nanograms per ml. We know from our studies in Boston in the wintertime, healthy adults taking 1,000 units a day, that essentially no one becomes deficient. Can you become toxic? No question. But we did studies with Bob Heaney many years ago and showed up to 10,000 units a day in healthy adults is perfectly safe. A study done in Canada showed some adults taking up to 20,000 units a day, no toxicity, never went above 100 nanograms per ml. So what about infants and children, right? A study was done by Catherine Gordon showing infants and toddlers can take 2,000 units a day for 6 weeks, or 50,000 units every week for 6 weeks without worrying about toxicity. Now here's an interesting case. This is in India, where a dermatologist asked a local endocrinologist, Dr. Marwa, that he had a child with ichthyosis and rickets and wanted to treat the vitamin D deficiency. And so the recommendation was to give 60,000 units a week for 10 weeks, right? Because in India, they have a 60,000 unit dose. The dermatologist misheard him. And in fact, this child with ichthyosis was getting 60,000 units a day for 10 days, 600,000 units in 10 days. Dramatic improvement in the ichthyosis. There was no toxicity. What about pregnant women? So Bruce Hollis and Carol Wagner showed 4,000 units a day is perfectly fine throughout pregnancy. Blood levels in the perfect range of 40 to 60 nanograms per ml. No change in serum calcium. No change in urinary calcium. Can you become toxic? No question. Here, a gentleman went on the internet to buy this product, thinking it was 1,000 units a day, and he became toxic. We did the study and showed and published New England Journal of Medicine that, in fact, the company forgot to dilute it. He was taking 1 million units a day, right? Calcium, extremely high, 25-hydroxy-D, 520 nanograms per ml. It is difficult to become intoxicated. And so why should you care? We know vitamin D, of course, is metabolized in your liver and kidneys and activated. And sure enough, regulates calcium metabolism. But every tissue and cell in your body has a vitamin D receptor. Why would they be there if they weren't having an effect? And so it turns out there's a lot of evidence linking vitamin D deficiency with increased risk for cancer. One of the first studies was showing 50% projected reduction just taking 1,000 units a day. And for breast cancer, 50% reduction when blood levels were about 48 nanograms per ml. 50% lower. What about COVID, right? We know that vitamin D has an effect on your immune system. Inactivated T lymphocytes, when activated, get a receptor, and 125-dihydroxy vitamin D made locally in macrophages and monocytes and dendritic cells regulates cytokine production. Inactivated B cells have no receptor. You activate them and they do, and vitamin D, 125-dihydroxy vitamin D, modulates antibody production, reducing risk for autoimmune diseases and other negative consequences. Activated macrophages activate vitamin D. We know that. Have you ever wondered why? Now know why. Vitamin D protects against tuberculosis. And a study done in 2006 by Adams, Maudlin, and Liu showed that if you infect a macrophage with TB, toll-like receptors are turned on to do what? It tells the cell to activate vitamin D. Why? It then tells the cell to express cathelicidin, a defensive protein that specifically kills and lyses infectious agents, including bacteria and viruses. And so we now understand why living at higher altitude, exposed to sunlight, had helped treat and prevent tuberculosis. We've always known that the flu season occurs usually in the wintertime, and it's been suggested that there is a seasonal stimulus. Indeed, at the peak flu season here, say in Boston, the blood levels of 25-hydroxy vitamin D are at their lowest. So studies have been done to show here in New Haven, Connecticut, that healthy adults who maintained a blood level of at least around 38 nanograms per ml reduced risk of upper respiratory tract infections twofold. Also, a study done in Japan showed school children taking 1,200 units a day during the wintertime reduced risk of influenza A infection by 41%. Also, the question is Is there any benefit on your immune system? And how do we know? Well, the best way to know is, of course, is that your genes know. And so we did a study, and we took healthy adults and gave them 2,000 units a day for 3 months and got their baseline level, making sure they were vitamin D deficient or insufficient, and obtained their white blood cells. And then at the end of the 3 months, obtained their white blood cells again, and did chip analysis of almost 23,000 genes. And we showed that all of these blue lines are genes that are underexpressed. All of the red, yellow, and orange are overexpressed genes. Just by being on 2,000 units of vitamin D a day for 3 months, 291 genes. All of these were upregulated, all of these were downregulated. We then did another study and asked the question, what if you gave higher doses of vitamin D? Would you even have more dramatic effect? And so we looked at a group getting 600 units a day for half a year, 162 genes being turned on or off. And on 4,000 units a day, all these genes are being turned on, these genes being turned off. 320 genes being affected. We then put some on 10,000 units a day. Look at this. All of these genes being turned on are now being turned off. All of these genes turned off are being turned on. 1,289 total genes being up and down regulated. And so we recognize that no question that there's very many pathways influenced by vitamin D supplementation: DNA repair, apoptosis, oxidative stress, metabolic processes, anti-inflammatory activity. Feed your genes right with vitamin D. So what about COVID, right? We know innate immunity and adaptive immunity are critically important. And 1,25-dihydroxyvitamin D plays a critical role in regulating both. The cytokine storm is a major issue and is a major complication from COVID that often can lead to morbidity and mortality. And 1,25-dihydroxyvitamin D, cleverly, by interacting with dendritic cells, monocytes, and activated macrophages, will downregulate cytokines that are potentially harmful and upregulate cytokines that are potentially helpful. And we also know that this virus is clever and it gets through the ACE2 receptor. And curiously, we know that 1,25-dihydroxyvitamin D regulates the renin-angiotensin system and may have some effect on its receptor. Well, these are all nice theories, but is there any good evidence that vitamin D status will reduce risk? Where is the evidence? And so we did a study with Quest Diagnostics and looked at 191,000 patients who were COVID positive throughout the entire United States and looked at their blood levels of 25-hydroxy-D. The higher their blood level, lower was their risk, and that continued all the way out to 60 nanograms per ml. There was a 54% reduced risk, even just at 34 nanograms per ml, that continued to improve the higher the blood level. What about people of color? And so we did the study and showed that whether you're African American or Hispanic or Caucasian, the benefit was the same. Latitude did not make any difference, and age did not make any difference. So you could be over 60 or under 60, higher your blood level of 25-hydroxy-D, lower is your risk. And it didn't matter whether you're male or female. And so, will vitamin D improve health outcomes? We did a study with Dr. Moghibouli in Iran, and we looked at 235 patients that presented to the hospital, 74% with serious complications. And we showed that if their blood level was above 30 nanograms per ml, they had less severity, unconsciousness, hypoxia, and they had improvement in lymphocyte number. We also looked at deaths over the age of 40 and showed 51.5% reduced risk of dying if your blood level is above 40 nanograms per ml. So we did get a lot of publicity for these studies for good reason. We also know from a Finnish study many years ago by Dr. Happonen that if you look at type 1 diabetes, she started looking at a study where they gave 2,000 units of vitamin D a day throughout the first year of life in Finland and showed an 88% reduced risk of acquiring type 1 diabetes for the next 31 years. What is the other evidence for diabetes? It turns out your beta cell has a vitamin D receptor, and activated vitamin D regulates insulin production. And so there is association with vitamin D status, metabolic syndrome, and type 2 diabetes. Very nice study by Dr. Pitash showed that the higher your intake of vitamin D and calcium, lower by 33% relative risk of acquiring type 2 diabetes. Also, multiple sclerosis, a study done out of Harvard showed women that had the highest intake of vitamin D reduced risk of MS by 41%. A study from Iowa showed women at the highest intake of vitamin D reduced risk of rheumatoid arthritis 44%. So what about heart health? Here, a very nice study from the National Health Survey showed higher your vitamin D, greater than 30 nanograms per ml, reduce risk by 80%. What are the mechanisms? We now recognize that vitamin D receptors exist in smooth muscle, in the heart, and there's evidence that regulating more than 200 genes for atherosclerotic production and cardiomyocyte function and regulating blood pressure. Also, a study out of the Framingham Heart Study showed that if you had a blood level of less than 15 nanograms per ml, you had a 50% higher risk of having a heart attack. What about living longer? Well, it turns out that a study done out of Germany showed blood levels greater than 30 nanograms per ml reduced risk by all-cause mortality by about 25%. Vitamin D deficiency is a disease of neglect. No question about it. Indeed, adequate vitamin D is necessary from birth until death. Right? There's a mountain of evidence linking vitamin D deficiency with many autoimmune disorders like multiple sclerosis, rheumatoid arthritis, and even Crohn's disease, increased risk for type 2 diabetes, for cardiovascular disease, for stroke, for many deadly cancers, including colon cancer and breast cancer, decreasing infectious diseases, just to name a few. Think about disease burden globally. Low birth weight, stunted growth, type 2 diabetes, hypertension, fracture, cancer risk, infectious diseases, and now COVID. Don't think about a normal level. What you want is a healthy level. How do you get there? Well, how do you know what your blood level should really be? Well, our hunter-gatherers thousands of years ago were exposed to sunlight, but unfortunately, we don't have the ability to measure their blood level. But however, we do for some societies, such as these Maasai herders who are outside every day exposed to sunlight. Their blood levels on average, 40 to 50 nanograms per ml. How do you get there? You would need to take 4,000 to 5,000 units a day to have that blood level. The goal should be minimum 30 nanograms per ml, 75 nanomoles per liter. It's ideal to have, as recommended by the Endocrine Society, 40 to 60 nanograms per ml, which is 100 to 150 nanomoles per liter. And so how much vitamin D do you need to get there? Well, if you take 100 units of vitamin D, you will raise your blood level by 1 nanogram per ml once you're above 20 nanograms per ml. So if you're in this range, and I guarantee that you are if you're not taking a vitamin D supplement, remember, we showed 1,000 units a day will not make you sufficient. Right? I recommend adults 2,000 units a day, children 1,000 units a day. Conquer vitamin D deficiency. The best source, of course, is sunlight, which I am a proponent of. Sensible sun exposure. right? Our ancestors' appreciation for the life-giving benefits of vitamin D is well recognized. The dermatologists, some of them, unenlightened dermatologists, they tell you never to be exposed to a direct ray of sunlight. In fact, always wear sun protection. Indeed, if you put a sunscreen on properly with an SPF of 30, you reduce your ability to make vitamin D in your skin by 97.5%. So what I typically recommend is to go outside for an amount of time that will not cause a sunburn. Always protect your face and wear sun protection after that initial exposure. Have you ever been on rounds with an unenlightened dermatologist? I like the kinder, gentler view of Charles Schultz, who had good insight into life. And in his penis character, Linus is getting a note from his mom here in California. Are you sitting in the sun? I hope so. A little sun is good, as long as you don't overdo it. Perhaps 10 minutes a day. This time of the is just about right. All that we do. Indeed, this is what's happened to our sun. Never to be exposed to one direct ray of sunlight. That's what's recommended by the American Academy of Dermatology here in the United States. Slip, slop, slop message in Australia. 40% of Australians are now vitamin D deficient. Who is that? That's an Australian dermatologist on vacation. And they did a study and measured their vitamin D status. 87% were vitamin D deficient. Vitamin D deficiency also is associated with schizophrenia, depression, dementia, and Alzheimer's disease. Indeed, you have a vitamin D receptor in your brain. Your brain can activate vitamin D. And indeed, there's a variety of neurological disorders that have been associated with vitamin D deficiency. And just came out this week a really interesting study in mice to show if mice were vitamin D sufficient, they were less likely to become opioid abusive. And so there is good evidence to suggest that vitamin D can improve serotonin levels, at least in mice, and can be therefore related to decreased risk of depression. Also, it may very well have some effect on making you feel better as well. And so this study showed a cheap, easy, safe way to treat addiction potentially by improving your vitamin D status. They suggest that you can get all of your nutrients from your diet. You cannot get enough vitamin D from your diet. Indeed, what do I recommend? Best source, of course, is sunlight. But time of day, season, latitude, degree of skin pigmentation, what is a person to do? So we developed an app. It's free on your Android and on your iPhone, dminder.info. It'll tell you, even in Ecuador, when you can make vitamin D, how much vitamin D you make, and it warns you to get out of the sun so you don't get a sunburn. What do? Sun protection on my face, but not on my arms and legs when I'm out in various activities. And I take up to 6,000 units of vitamin D a day. My blood level on average is about 70 nanograms per ml. Vitamin D deficiency is probably the most common medical condition worldwide. If any one of these chronic illnesses, right, and especially now with COVID, right, turn out to be associated with vitamin D sufficiency, there's no downside to increasing your vitamin D intake. This is not a hypothesis. We need sensible sun and vitamin D supplement recommendations. Indeed, should you be screening everybody? As you know, it's often difficult to get the test, can be expensive, and sometimes doesn't work very well. And so we've done a study, and we showed and published in Archives of Internal Medicine several years ago that you could give patients 50,000 units every 2 weeks, an equivalent of about 3,000 units a day for up to 6 years, not even worry about their baseline. We got their baseline level, but put aside and measured it 6 years later and showed even those that had a blood level of 30 or 40 or 50 and giving them 3,000 units a day, they raised their blood levels to about 60 to 80 nanograms per ml. There was no toxicity. So there is no need to be having screening. However, if you have sarcoid, right, granulomatous disorder, if you have a 24-hydroxylase deficiency, if you're obese, if you have gastric bypass surgery, malabsorption, all of those need to have baseline and to be followed. I've written a book called The Vitamin D Solution that's now in a Spanish version, and vitamin D can improve your health. No question about it. Here comes the sun. So we conclude with this online talk. It's been my pleasure to share with you all this information and contribute to your professional development. It's very important that we learn more about the medical benefits of vitamin D that provides all of the medical community with health benefits. We can transmit this in favor of our patients. I hope that it's been of interest and that we have fulfilled your expectations. Thank you very much for your attention. I'm happy to have participated in this International Forum for Women's Health, MUSA 2021. I invite you to continue seeing all of the on-demand talks and live events that are part of the platform. And to do that, remember to enter www.musa2001.com. It's time to say goodbye. My best wishes so that you can continue with your professional performance until the next time. Thank you for your kind attention.